lanjut silakan klik subscribe dan tanda lonceng untuk mensupport kami berbagi info menarik dari Bahana Televisi.
Interesting aspects that's going to help you be better prepared and also answer some of the questions and how to take care of challenges with the patients in this situation. With that, I'm going to take this video here and I'll take it up further. And this is the ventilator that we had seen before, again 840, and I'm going to turn this on. Now when you turn this on, it's important to keep in mind that we will not have a patient attached to the situation. And if the patient is not attached, only then will the ventilator be able to be set. And if you remember, one of the things that we had set up, the multiple channels and contacts, keep this in mind. You can cap the ones that you're not using. So this is a smart way to do this, is to make sure the ones that are not being used are closed. So we are doing just, I didn't want to do the whole exercise all over again for the 7 ventilators, but I wanted to actually 7 patients. I am doing this with 2 of those closed, and we are going to do 2 lungs to illustrate some important examples. The part on the inhalation side and the part on the exhalation side. Both of them are there. So now with the ventilator setup, some concepts to be kept in mind. So I am actually going to set up an IMV mode, and I want you to understand this. There's a reason for it, and I'll explain that to you in a second. So when we do the IMV mode, just to illustrate, I'm putting a rate of 10 and I'm doing a pressure control mode. And the pressure control mode, I'll set that up. So first we set up a weight for the patient, and the weight of the patient, in this case, I'm just going to go to a maximum for the time being. And we will at this time also go to IMV mode and pressure control. And I'm not going to give any pressure support, 0 pressure support. So there is a rate of 10. Tidal volume is not set as at this time because the pressure control mode, and 0 pressure support. And oxygen, again, we are not going to use any oxygen as we try to do this. And PEEP, now keep in mind, and I'll go over this as well, it's worthy to talk about. I'm just setting this up at PEEP of 10, and with that I'm going to accept this. And at this time, the machine is going to say that we are waiting for a patient to connect. Now as we are setting up for the patient to connect, I will connect this patient over here. This is another patient, right? And I'll come over here and connect another patient. Now the machine should start to talk. You can come up here. Now here's the thing. The machine is right now a little confused because the tubes are so long and there are so many patients. So there's a way I can play with the mind of the machine. I will disconnect over here and put my thumb in here, and the machine feels that there's a cough, and right now immediately the machine starts to do its work. So we do turn the alarm off, and now you can see this lung is getting the ventilation, and so is the other lung getting the ventilation. Now the brilliance of the pressure control. First, let me just talk about the PEEP. The patients that we are going to deal with.
jacket. We don't want you to get cold.
Terima kasih Anda telah menonton channel kami. Silakan klik subscribe dan tanda lonceng untuk mensupport kami agar terus berkarya.